Good morning. I take this opportunity to welcome you all at the MBBS program. And you are some of the few gifted persons who have managed to crack the NEET exam and get selected for this prestigious course. And I should let me warn you at the outset that this course is not a bed of roses, and the entire course duration is prolonged. The examination is difficult. The study per se is arduous. So you are all in for a long haul. So we can divide the training phases of the entire MBBS curriculum into three phases. The first phase lasts for 12 months, which includes 2 weeks of foundation course. That is what you are undergoing now. This is actually the first topic in the foundation program. And then in phase 2, the duration happens to be 12 months, which includes the university exams also. Phase 3 is the longest duration. It lasts around 30 months. In phase 1, the subjects covered in phase 1 include anatomy, physiology, biochemistry, and introduction to community medicine. Let me tell you that community medicine is one subject which is present in all three phases. It is taught in all three phases. So this should tell you that this subject is very important, and National Medical Commission has had so much of importance to this subject. So it has decided to include this subject in all the three phases. And you all know there is actually another entrance exam which you will have to undergo or crack to get into a postgraduate program. So majority of the questions, the weightage will be given to topics under community medicine. And then comes AdCom module, which is nothing but attitude, ethics, and communication module. Family, and then next comes family adoption program. Every student will be allotted 5 families, and you are supposed to visit each of these 5 families at least once a month and take a history. You are supposed to be the health monitors of those families. So you'll be taken to a particular area, a village close by, and each one of your students will be allotted 5 families, and you're supposed to follow up the health indices of the members of the family. The time allotted for phase 1 is 12 months, which is roughly 52 weeks, and the time available for teaching is around 39 weeks. Among the 52 weeks, the time available for teaching is going to be only 39 weeks. The total teaching hours lasts for 1,521 hours. And then the first subject happens to be anatomy. It's a little bit difficult because of the terminologies involved. These terminologies are Greek and Latin. Majority of the terms involved and nomenclature involved will be in Latin. Commonly, Latin is the language which is used in anatomy, particularly for the nomenclature, the naming conventions. The total teaching hours devoted for the study of anatomy happens to be 620 hours, out of which 180 hours are devoted to large group teaching, which is nothing but a classic classroom teaching. Then comes small group teaching, practicals, tutorials, and seminar. This gets allotted 430 hours. So this goes without saying that NMC is giving more importance to small group teaching, more importance to practical learning, more importance to tutorials and seminars. Then comes self-directed learning. The self-directed learning is allotted 10 hours. What is happening is, because of the delay in the admission process, the entire 12-month program is getting condensed into 7 or 8 months. So we may not have adequate time. The faculty may not have adequate time to cover all the portions. So they may push some of the chapters into self-directed learning. And molecular biology is one of the topic which is allotted for self-directed learning. And students will be given study materials. They'll be handled by the faculty, and assignments will be given, and any doubts, if any, when they start their self-directed learning process, any doubts they come across or any problems they face in this process of self-directed learning will be addressed by the faculty. They'll be there to handle them. Then comes the physiology, next important subject in the first phase is physiology. The total number of teaching hours is 445 hours, out of which again large group teaching involves 130 hours, small group teaching, practical and tutorials involve 305 hours. Again, small group teaching and practicals are given more importance than classic classroom teaching. Then comes self-directed learning, which is again allotted 10 hours. Now biochemistry, and this is again third subject which is included in the phase 1, and total number of teaching hours allotted to biochemistry is lesser when compared to that of anatomy and physiology. It happens to be 249 hours, out of which large group teaching consumes 82 hours and small group teaching, practical and tutorials consume 157 hours, and self-directed learning lasts for 10 hours. Then they give lot of importance to early clinical exposure. So you will be taken to OPD, taken to ward, and 27 hours you will have to spend on this aspect of early clinical exposure. And these 22 hours will have to be divided equally between these three subjects, time allotted between these three subjects. So here in the early clinical exposures, clinicians will come and take regular classes, and they will teach you the basics of clinical examination, and these things you will be testing waters on how to examine the patient. Now comes AdCom module. This is called Attitude, Ethics and Communication module. This module is allotted 26 hours. This module is actually longitudinal, wherein this module is there for across all three phases. Module will be across all three phases. Now let us go to the examination part. In the first phase, exams, you should know one important thing, that you will have to pass the phase 1 exams before getting into phase 2. You should pass phase 1 before getting into phase 2. So you should have cleared phase 1. For you to pass, you should secure 40% separately in theory and practical. I repeat, it is mandatory for you to secure 40% marks separately in theory and practical, and 50% aggregate for theory plus practical. So it goes without saying, every paper you should have 40% for theory and practical. And then in the event of you clearing the first hurdle of securing 40% separately in theory and practical, then you add all those marks, and the average of clinicals, practicals and theory, you should secure 50%. So this is actually a must. 40% individually and 50% average you should have to pass the exam. In anatomy, you have 2 papers. Maximum marks is 100 for each paper. For theory and practical, again is allotted 100 marks. Physiology again has 2 papers. Maximum mark is 100 for each paper, and then practical maximum marks is 100. Biochemistry again 2 papers, maximum marks 100 for each paper, again practical 100 marks total. And then in anatomy paper 1, which is valued for 100, these are the general topics which are included in anatomy paper 1, which includes general anatomy. The breakup happens to be 6 marks, general histology 5 marks, general embryology 8 marks, upper limb 17 marks, thorax and including diaphragm is 20 marks, head and neck 27 marks, neuroanatomy 12 marks, AdCom 5 marks. So just seeing the marks distribution, you can see the lion's share of the marks is given for upper limb, thorax, diaphragm, head and neck. So if you manage to neuroanatomy, if you manage to be really good in all these 4 topics, you can effortlessly clear paper 1. And then paper 2, anatomy paper 2, systemic histology marks allotted is 11, systemic embryology mark allotted is 11, genetics is 8, lower limb 17, abdomen 28, pelvis 20, outcome 5. Again, lower limb, abdomen and pelvis, if you focus or concentrate, you can easily clear paper 2. Anatomy exam blueprint. This is actually the type of question. It's actually the outline of the question. The duration of each theory paper is going to be 3 hours, and the entire paper will be divided into 4 sections, A, B, C and D. Section A will contain multiple choice questions. It will be 20. Number of questions will be 20, out of which 5 will be scenario based. So MCQ, there will be 20 questions, and out of which 5 will be scenario based. So total marks allotted for multiple choice is 20. Supposing if you are prepare well, if you hit my multiple choice questions and get 70% out of this 20, again your passing becomes that much easy. Then section B has a long essay which is structured, which will have subdivisions. The question will have subdivisions, and each subdivision will be allotted separate marks, and the structured essay will carry 10 marks. And then there is C section will have reasoning out. There will be 5 questions reasoning out. Each question will carry 3 marks, total 15 marks. Then comes short notes, 11 short notes, and compulsorily 1 short note among 11 will come from ATCOM module. Totally 5 marks per short note, 5 into 11, 55. And then in the short notes itself, among the 11 short notes, 2 short notes will be from the applied aspect of anatomy, which includes diabetes mellitus, hypertension, anatomy, anemia, in IHT, thyroid and tuberculosis. So these will have integrated modules. 2 short notes will be from the integrated module. What do you mean by integrated module? So when you start learning anatomy of the heart, you will be taught hypertension, you will be taught ischemic heart disease, the common diseases which involve the heart. So this is what you call integration of anatomy with the medicine. So 2 short notes will be from the applied aspects compulsorily. Then anatomy practical. Practical again, the total marks allotted is 100, out of which gross anatomy is 40 marks. You will be given spotters, 10 spotters of 2 marks each, around 20 marks. And then window discussion. One window will be above diaphragm, 10 marks. The next window will be below diaphragm, that will be 10 marks. Then histology, 40 marks is allotted. Spotters 10 into 1, 10 marks. Slide discussion, general histology 10 marks. Slide discussion, systemic histology 10 marks. Then they will be given OSPE 2 into 5. 5 OSPE, each OSPE 2 marks, total 10 marks. Then oral exam or YOC, 20 marks is allotted. Osteology, surface marking, radiological anatomy and embryology carries 20 marks. Now let's come to physiology. Physiology again, paper 1, it has 2 papers. Paper 1, general physiology has 5 marks, hematology 20 marks, cardiovascular system physiology 25 marks, respiratory system physiology 20 marks, gastrointestinal tract physiology 13 marks, renal physiology 12 marks, ATCOM module 5 marks, totally 100. In this, if you watch hematology, CVS physiology, RS physiology and GI tract, if you focus, you should be able to get to that 40% or 50% mark. Then physiology paper 2, nerve muscle physiology carries 12 marks, endocrine physiology carries 20 marks, reproductive physiology 14 marks, central nervous system 32 marks, special senses 10 marks, integrated physiology 7 marks, ATCOM module 5 marks. Here you see central nervous system is allotted 32 marks. See the weightage given to central nervous system. And then endocrinology, again 20 marks. Supposing if you very good in endocrinology, central nervous system, and reproductive physiology, passing paper 2 is going to be a cakewalk for you. Now, let us go to the blueprint of the question paper. Again, it has 4 sections. Each paper will have 4 sections. Section A, as seen in anatomy, it will have a multiple choice question of 20 marks. 5 questions will be scenario based. Then section B, long essay question, which is again structure, 10 marks. Section C, reasoning out question, which will have 5 questions into 3, 15 marks. Section D, 11 short notes. Each short note carry 5 marks, 55 marks. And here 2 short notes will come from applied or related integrated modules. These are all the integrated modules: diabetes mellitus, hypertension, anemia, ischemic heart disease, thyroid, tuberculosis. And there will be 1 short notes from the outcome module. So NMC has made the passing these exams that much easier for you by giving you a proper blueprint. If you meticulously follow the blueprint and prepare accordingly, you can easily pass this examination. Physiology practical, again, practical exam 80 marks, Viva 20 marks. There will be 4 practical sessions, each carrying 20 marks. Physiology Viva, total 20 marks. The first 5 marks will be given for general physiology, blood, muscle, nerve physiology, and gastrointestinal tract. Then 5 marks will be given for renal physiology, endocrine, and reproduction. 5 marks allotted to CVS, RS, integrated physiology. 5 marks allotted to central nervous system and special senses. Biochemistry, again, paper on 100 marks. You can jolly well see the mark allotment for each of the topics. Here again, if you prepare well, say for example, if you focus on enzymes, carbohydrate chemistry, carbohydrate metabolism, and then lipid metabolism, vitamins, minerals, and then nutrition, I think you should be able to cross that 40% and go up to 50%. Then biochemistry paper 2, again total marks is 100. This is the distribution which was supposed to which the NMC has suggested in its curriculum. And your paper, if you focus on this, say focus on these 10 marks, this takes up the lion's share of the marking. It's always better. This way you can easily get a pass. Biochemistry question paper marks, again, blueprint. This is a blueprint. Multiple choice questions 20, out of which 5 are scenario based. Mark per question is 1 mark per question. Section B, long essay question, should be scenario based, 10 marks. Section C, reasoning out question will be 5, 3 marks for each question, to be 15. And then short notes 11. Each short note has 5 marks, and 2 of the short notes will be from applied or related to the integrated modules, and 1 from AdCom module. Biochemistry practical, 80 plus 20, 100. Exercise 1 is OSPI, that is 20 marks. Exercise 2 is qualitative analysis of normal and pathological constituents urine examination is 20. And then quantitative estimation interpretation 20. Case and chart discussion 20. Viva is 20. So this is how, this actually I have given you the blueprint for university examination. For you to become eligible to appear for the university examination, you need to match these criteria or pass these criteria. One is the minimum attendance of 75% in theory, then minimum of 80% attendance in practical and clinical, minimum of 75% attendance in AdCom, and minimum of 80% in family adoption program. And you should have got 50% aggregate from the internal assessment examination. We will be conducting 3 to 5 internal assessment examination. You should ensure that you should have an aggregate of 50% in the internal assessment exam. And next comes attendance in allied branches. So if an exam comprises of more than one subject, a candidate should have 75% in each subject, And allied branches, they should have 80% in each clinical posting. That's how it is. Then internal assessment, I have already told you, each internal assessment, each subject will be out for 100 for theory and 100 for practical and clinical. For final year subject, it will be 200 for theory and 200 for clinic. Just, I repeat again, internal assessment for each subject will be 100 for theory, 100 for practical and clinical. For final year subjects, it will be 200 for theory and 200 for clinical. For the subjects that are taught across the phases, cumulative internal assessment will be used for eligibility criteria. What is the eligibility criteria? 50% average you should have secured. Phase wise pass details. One thing you should know, I have already told you, the first phase is a critical phase or crucial phase. You should clear that phase or pass that phase before you go to the second phase. If you fail, in the event of you failing the phase 1, you will be given, there is a lifeline for you. Within a month's time, you will have a supplementary examination. If you manage to clear the supplementary examination, you can continue in the same batch. But if you happen to fail in the supplementary exam, you need to stay back for a year and join the junior batch. Hope you understand the problem. First year is the most difficult and the hurdle which you should cross. And you should also have one thing in mind. Take the first year seriously. You should clear the first year before you can get into the second year. And then you have just 4 attempts to clear the first year. If you are not able to clear the first year within the fourth attempt, you need to get out of the course. I repeat again, you need to clear the first year within 4 attempts. If you don't clear the first year within 4 attempts, you need to quit the course. A candidate again who fails in phase 2 examination can join the phase 3 part 1 training, but you cannot appear for the university examination until and unless you clear the phase 2 examination. Again, a candidate who fails in phase 3 part 1 examination can join the phase 3 part 2 training, but will be allowed to appear for exams only after clearing phase 3 part 1 exam. Thank you.